What is long-term planning for rheumatoid arthritis? When living with rheumatoid arthritis, long-term planning is essential for managing this chronic autoimmune condition. It focuses on controlling disease activity, preventing joint damage, and maintaining a good quality of life. Since there is no cure for rheumatoid arthritis, the goal is to minimize inflammation and preserve joint function through a mix of medical treatments, lifestyle changes, and supportive care. One of the first steps in long-term planning is early and aggressive treatment. Starting disease-modifying antirheumatic drugs, especially methotrexate, is crucial. This helps slow down disease progression and prevents irreversible joint damage. The treatment often follows a treat-to-target approach. This means aiming for remission or the lowest possible disease activity by regularly checking symptoms and adjusting medications as needed. If methotrexate alone does not work well enough, doctors may add or switch to other disease-modifying drugs or biologic agents. Managing flares is another key part of long-term planning. Flares are periods when symptoms and inflammation increase. Recognizing these flares early can help in managing them effectively. This might involve temporary changes in medications, using corticosteroids for quick relief, and non-drug measures like rest and physical therapy to ease joint stress. Regular monitoring is vital for preventing complications. This includes checking for joint damage and potential side effects from medications. Long-term planning also involves preventive measures like vaccinations, monitoring bone health, and managing cardiovascular risks to reduce complications related to rheumatoid arthritis and its treatments. A multidisciplinary approach is important for effective long-term management. This means working with rheumatologists, primary care providers, physical and occupational therapists, and sometimes surgeons. Patient education plays a big role too. Understanding the disease, treatment goals, and lifestyle changes can help improve outcomes and adherence to the treatment plan. Lifestyle adjustments are also crucial. Incorporating physical activity that suits individual abilities, maintaining a balanced diet, quitting smoking, and managing stress can support overall health and may help lower disease activity. Using assistive devices and making ergonomic changes can aid in maintaining function and independence. In some cases, surgical options may be necessary. If joint damage leads to significant pain or disability despite medical treatment, surgeries like joint replacement or synovectomy might be considered as part of the long-term plan. Overall, long-term planning for rheumatoid arthritis is a dynamic and personalized process. It balances aggressive medical treatment with supportive care and lifestyle management to control disease activity, manage flares, prevent complications, and maintain quality of life over time. Regular follow-ups and open communication with healthcare providers are essential to adapt the plan as the disease evolves.